Hey everyone, and welcome. Today, we're diving into the really complex world of dissociative disorders. And this isn't just about understanding a clinical diagnosis, not at all. It's really about a journey from a place of being internally fragmented all the way toward integration and wholeness. So, let's start by digging into what that fragmentation actually feels like.
It's a heavy question, right? But think about it. I think we've all had moments of feeling a little detached, a little off. But for some people, that feeling of being a stranger to yourself isn't just a fleeting moment. It's persistent, it's profound, and it's at the very core of an experience that can completely shape a person's life.
So what are we really talking about here? Well, the official definition talks about a disruption in how we normally stitch our experience together, our consciousness, our memories, our sense of self. But the most crucial part of that definition is the why. This isn't just some random glitch. It's often the mind's powerful, unconscious way of protecting itself, a defense mechanism that kicks in to shield a person from stress or trauma that is just too overwhelming to handle. To really get our heads around this, we have to look at the core experience itself. What does it actually mean to be in that kind of disconnected state?
You can think of it like this. Dissociation is a fundamental split. It's like the phone lines have been cut in the conversation that's supposed to be happening between your mind, your breath, and your physical body. They stop talking to each other. And this is exactly why these conditions are so often tied to trauma early in life, a time when that essential sense of safety and connection got fractured in the first place.
Okay, so if that's what's happening on the inside, how does it actually show up on the outside? Let's take a look at the symptoms we can recognize, because dissociation isn't just one single thing. It has a lot of different faces. This table does a great job of breaking down the three main disorders. First, you have dissociative identity disorder, or DID, where the core feature is the presence of two or more distinct identity states. Then there's dissociative amnesia, where the main issue is an inability to remember important personal information, usually centered around a traumatic event. And finally, you have depersonalization/derealization disorder. This one is all about a profound feeling of unreality, either feeling detached from your own self or feeling like the world around you is fake, like you're walking through a dream. And even though those are distinct disorders, there are these common threads that run through all of them. Things like feeling emotionally numb, a deep confusion about who you really are, physical symptoms that doctors can't explain, and of course, all of this creates huge challenges in just getting through daily life and maintaining relationships.
So how on earth do you get clarity on something this complex?
Well, there are two really different lenses we can look through to understand it. The lens of modern medicine and the lens of the yogic framework. And both are aiming for the exact same thing, clarity. And you can see here just how different those approaches are. Modern medicine is all about the DSM-5, right? That's the big diagnostic manual. It uses specific clinical criteria and assessment tools to land on a diagnosis. The yogic framework, on the other hand, doesn't really use formal labels. Instead, it looks at the degree of what it calls mental fragmentation by observing things like the patterns of someone's breath or their connection or lack of connection to their own body. And why is getting that diagnosis, that clarity, so critical? Because the stakes here are incredibly high. When left untreated, dissociative disorders can lead to really severe complications. We're talking about a serious risk of self-harm, struggles with substance use, and just major difficulties in navigating day-to-day life. The bottom line is, recognition is the very first step towards safety and healing.
So let's start by looking at the healing path offered by modern medicine. It provides a very structured, phase-by-phase approach to help someone find their way back to integration. The absolute cornerstone of treatment is a specific type of trauma-focused psychotherapy, and it usually unfolds in 3 stages. The first one, and it is the most important one, is all about establishing safety and stability. You have to build that foundation first. Only then, when a person feels safe and grounded, can the incredibly careful work of processing trauma begin. And the final phase is about integration, bringing those fragmented parts of the self back together and rebuilding a life that feels functional and meaningful.
Now, it's also really important to understand where medication fits in. There's no pill that cures dissociation directly. It just doesn't exist. Instead, medication is used as a supportive tool. It helps manage the other conditions that often come along for the ride, like severe anxiety or depression, which can make it possible for the real therapeutic work to even happen. Okay, so now let's switch gears and look at how a totally different tradition approaches this. Yoga offers a complementary path, and it's one that's focused on healing that fundamental disconnection between the mind and the body.
This starts with asana, which are the physical postures.
Now, the key here isn't about athletic performance or looking perfect in a pose. Not at all. It's about using gentle, grounding movements to help a person safely reconnect with their physical body and just begin to notice sensations again, maybe for the very first time.
Next up is pranayama, or breath regulation. And honestly, this is incredibly powerful stuff. By learning to use slow, rhythmic breathing, a person can directly influence their own autonomic nervous system. The body's autopilot. This helps calm that state of hyperarousal, that fight or flight response, that for so many trauma survivors is basically stuck in the on position.
And then you have mindfulness and meditation. Now, for someone with a dissociative disorder, this has to be approached very, very carefully and gradually. The goal is to cultivate a non-judgmental awareness of what's happening inside, but it's always paired with grounding techniques to make sure the person feels safe and present in their body.
All of these principles really come together beautifully in an approach called trauma-sensitive yoga. The emphasis is always on giving the individual choice and control over their own body and their own experience. It's about empowerment. It's about creating a space that feels absolutely safe, and that's precisely what makes it so effective.
So, where does all this leave us? Well, it's not with an either-or choice. It's with a really powerful integrated path to wholeness that builds a bridge between modern science and ancient practices of self-awareness.
And this brings us to one of the most crucial ideas in healing. Psychotherapy helps a person process the story of their trauma, the narrative, the memories, the meaning behind it all. Yoga, working right alongside it, helps a person address the score, that physiological imprint that the trauma literally left on the body and the nervous system. To truly heal, you really have to address both.
So ultimately, when you combine these approaches, you get the most holistic and patient-centered path to recovery possible. It's a path that honors both the mind's need to make sense of what happened and the body's deep need to finally feel safe in the present moment.
So what's the big takeaway here? It's really about knowing when it's time to seek help. If you're experiencing persistent gaps in your memory, if you feel confused about who you are, if you often feel detached or like the world isn't real, and if these things are getting in the way of your life, it's time to talk to a professional. And please, this is so important. If there are ever any thoughts of self-harm, that is a sign to get help immediately. This famous quote from Dr. Bessel van der Kolk just perfectly captures everything we've talked about. The body keeps the score. Trauma isn't just an event that happened to you, it's an experience that gets stored inside your body. And that means healing has to involve the body too.
And that leaves us with a final question to really think about. As we learn more and more about this incredible connection between our minds and our bodies, maybe the future of healing lies in building ever stronger bridges between the rigor of science and the deep wisdom of self-awareness. Something to ponder. Thanks so much for watching.